Thank you for having me. I love everything that you're doing. This is a very powerful, powerful show.
It's great to be on the podcast, so I'm rooting for you.
We are so excited to be here, and I'm so glad you have started this podcast. There's such a need to communicate this to patients.
Thank you for doing this show. This is the type of show everybody should listen to.
I've been listening to your podcast, and really a congratulations to you on launching your podcast and being able to have these conversations.
What you're doing with Genetics for Healthcare is empowering patients and caregivers, making them aware of something that they need to ask for, because not all clinicians are either going to be aware of this because it's not standard practice.
If I can impact one person, it makes me so happy to have spent this time with you.
Championing a show like this and featuring patients like us, not only is it imperative, but it is appreciated, because oftentimes in the sickle cell space, we don't always feel supported by industry, because sometimes it feels far removed, but you are doing the heavy task of kind of bridging both industry and patients and really serving the patient community. And so for the work that you're doing, I just want to say thank you so much for seeing us. It's one thing to recognize that we exist, it's another thing to truly see us.
This is Genetics for Healthcare, a podcast for patients.
This is Genetics for Healthcare, a podcast for patients and their caregivers to help them advocate for a precision medicine approach to disease screening, prevention, and treatment. My name is Ron Madison. Thank you so much for tuning in. This is episode 21. This is going to be a look back episode of our first 20 episodes. And off the top, I want to thank you. Off the top, I want to thank you, the listener, all of our listeners globally who have tuned in to Genetics for Healthcare, who have followed us on our social media platforms, who've went to our website, geneticsforhealthcare.com, and become a subscriber and have shared this, told people about it, or found value in it in some way. I want to thank you, because we have listeners in 29 countries around the world on 6 continents in just 20 episodes. And I can't thank you enough from the bottom of my heart. I want to give you some shouts out because, this is amazing to me to know that you're finding enough value of it in sharing this. So our listeners, our top 4 countries, obviously the United States, almost 90% of our listenership, not 100, almost 90%. And then there's Canada, Mexico, and then there is India. Actually, are our top 4 countries where we have listeners. But I want to read these off. These are 29 countries. In addition to, Mexico, Spanish-speaking countries, we have listeners in Spain, Chile, Brazil, Puerto Rico, which is a country, but it's part of the United States. But Argentina. Thank you guys for listening. We also have listeners on the African continent in South Africa, Kenya, Nigeria, Ethiopia. We have listeners in Australia. Thank you for tuning in. We have listeners in Pakistan, Saudi Arabia, India, Canada. Well, I already said India and Canada. Germany, Dubai, the UAE. The UAE being the country, United Arab Emirates. Israel, France, Ireland, Austria, Bulgaria, Switzerland, Romania, Serbia, Syria, Georgia, Portugal, and New Zealand. Thank all of you for joining us. I just can't thank you enough. I'm just so floored by how this has been of value to people around the world, and you saw fit to follow us and subscribe to us. Our social media platforms. At the beginning of every episode, I always rattle off where we are on social media and tell you to go there. And what I've learned is that if I send you everywhere, people tend to go nowhere. So I'm very proud that we have over 36,000 views on YouTube. YouTube is probably our fastest growing platform. And what I've learned is people will watch our videos, because even if you're watching or listening to this on Spotify or Apple Podcasts or Amazon, we have a video platform. So love that you're there. Please, wherever you're listening, hit subscribe. Follow us so you can get updates on new content. But especially on YouTube, if you watch this on YouTube, we got a lot of people who watch but don't subscribe. So please hit that subscribe button. If on whatever platform you're on, we really value your presence and your attention. And thank you for being a listener. I send everybody to genetics4healthcare.com because you can subscribe to our podcast. And then when you subscribe, you can get the transcripts for each episode that you wanted for. And then you can keep up, because we may not do look back episodes very often, but we can give you content that is related to specific syndromes such as colorectal cancer or cardiomyopathy. We'll batch those as we continue to create content, because this is a weekly show. It's a weekly show. So thank you for that. Please go to genetics4healthcare.com. So looking back over the first 20 episodes, how many people have we interviewed? We actually interviewed 21. 11 of those are people who have had cancer or sickle cell disease, and they share their firsthand accounts of it, or they're a caregiver of someone who has firsthand experience battling a disease and sharing their story with us. So we really appreciate those guests that we've got. Among those, they are Emmy-winning journalists, filmmakers, pre-cancer previvors, those who've made decisions in their healthcare to prevent a cancer diagnosis from happening in their lives. We've covered 7 diseases. I won't list those. How many genes? Well, I wouldn't say that there was an intentional focus on creating content about individual genes or conditions, but I do recognize that 80% of our content is cancer related. And that's because of my background. I've spent over 2 decades in this field of precision medicine as an executive, as a head of sales, as a strategist, a business strategist, bringing new products to the market. And what I do as a consultant and a podcaster now is, one, I want to reach patients. I want to educate people, everyday people who need the language, who need the confidence to have these conversations to ensure these genetic and genomic insights are considered for their health care. Lots of potential, because the reality is many times your doctor may not know. Your care team may not know about these things. So we want you to feel confident that you can initiate these conversations and become a more effective advocate for yourself or your loved one, for them to order certain tests or look at certain genes, and just have this as more information. We believe that this is not just the future, it is here. So there are so many ways that we can leverage it, and we want to help you and be a resource. Of course, the hallmark of Genetics for Healthcare, if you've listened all the way through at any episode, one of the last things I ask our guests is to share 3 practical tips to help you, the listener, become a more effective advocate for yourself or someone that you love. So along the way of this look back, we're going to share many of those practical tips, firsthand information where people are sharing, hey, this is what I did not know and I wish I knew before this. So we're going to share you those tips. We're going to give you certain questions to ask. We're going to give you the knowledge that you need to initiate, because in the event that your care provider doesn't know, you'll be able to give them those resources to help you, help them help you. Okay. So what did I learn in 20 episodes? First of all, how do you squeeze, because this is almost 20 hours of content. How in the world am I going to squeeze this into one episode? So I decided to break it up into 2 parts, because again, I mentioned I had 11 episodes, or excuse me, 10 episodes with 11 patients. One, we had an expert and a patient, but we had 11 people with firsthand experience conquering their chronic genetic disease or caring for someone who battled a chronic disease like cancer. And so I wanted to share some excerpts of these patient stories, because they're so powerful. They're so impactful to encourage us, to give us the confidence to take action with these genetic and genomic insights. And next week, for episode 22, we're going to do a look back episode of the conversations and episodes I've had with experts, medical experts in the field, because they came on to tell us why this genetic and genomic information should be relevant to us, and to help us use the language to communicate with doctors. And this is the hidden nugget these experts are helping us become more effective listeners. Because a lot of times when we get bad news in our health report, we seize on one thing and everything just kind of washes over us. But they help us become a more effective listeners to understand how they're using the language and the keywords they're saying and how to respond or ask strong questions that can help you in your healthcare journey. So I think the most powerful place to start in a look back is with the two guests that I had on the show that were the first to undergo gene editing, CAR T therapy, CRISPR technology. You hear all of those interchanged, but the therapies are the same. Okay. It's about knowledge. You can go do your homework, but we want you to be familiar with these terms, and these stories are powerful. It just speaks to the miracle of genetics, fulfilling the promise of what we were able to do as an industry over 20 years ago by the completion of the Human Genome Project. We put a man on the moon. This is the equivalent of putting a man on the moon for healthcare. Our ability to know our genes, to understand what that means, to find the mistakes, and then to actually act on them through medication that might be targeted to that gene aberration or variant mutation. Those terms are interchangeable, you'll hear. And then ultimately with these two, to edit the genes. So we're going to jump into this. First of all, I learned from Victoria Gray in her story. You'll hear the pain and suffering that not only Victoria, but also Tom Whitehead. Victoria Gray, episode 3, Tom Whitehead, episode 11. You can find that on our website. But I just learned a tremendous amount about sickle cell disease and beta thalassemia patients and the hardships that they go through in life, the discrimination that they go through in the healthcare system, the pain and suffering. I also learned from Tom the pain that he endured. You can still hear it in his voice. He still chokes up, of almost losing a child to cancer, of this cancer, which over 90% of patients, these kids are cured of, but not his daughter, Emily. Emily did not respond to traditional therapy. And in the end, she had a 1 in 1,000 chance to live and to conquer her cancer. And through gene editing, she did. And in both cases, they talk about how their children gave them the courage to fight and the faith to believe that they could beat the odds and have unreasonable confidence to take action and take the chance on gene editing, the full promise of genetics and genomics. And then we'll hear from Victoria Gray, the first sickle cell patient ever treated and cured with gene editing. Tom Whitehead is the father of Emily Whitehead. Emily Whitehead was 7 years old at the time. She was the first pediatric cancer patient treated with gene editing for her ALL condition. And after each, you'll hear the practical tips to advocate for yourself with doctors, to have a conversation about gene editing, about CAR T, and how to advocate if you feel that this is something that you want for you or your loved one. So let's listen in.
Most of all, what hurt the most, and it was my wake up call. I had began to be tired. I was sick a lot. Going into the hospital seemed like I was home maybe 2-3 weeks at the most, and back in the hospital. My oldest son behavior, he started to get in trouble a lot at school, just small stuff, disrupting class, shooting paper basketballs, um, being mean to other students, like just doing petty stuff. And my twins, my girl and boy, they was helpers at the time. They would like to help the teacher out in the classroom, and they kind of stopped doing that and retreated inward. So their teachers would know when I was in the hospital. So they would call or text like, "You're in the hospital." I was like, "Yeah, how did you know?" And your kids are acting different. But this one particular day, my son's teacher called and she said, "Victoria, I need you to come to the school." And so I came and she sat me down and she said, I'm just going to be honest with you. She said, Jamarius is acting out because he's afraid you're going to die. He don't want to be at school and come home and you're not there. And that hurt me because at that time, I wanted to die. I felt like my kids would be all right. But hearing and seeing how my life was already causing them those traumas and deep hurt, I couldn't imagine what my death would do to them. So that energized me to look for treatments. While I was there undergoing testing, I went into crisis. He moved immediately when I said I was hurting, and he can see it on my face. He I didn't have to explain my pain regimen. He went in, didn't question what I normally took for pain. He gave it to me. I didn't have to overly explain anything. And while I was there, um, that's when he approached me by my bedside and said that the CRISPR trials was opening up. He asked me, have I ever heard of it? And I hadn't. And that's when he began to explain that it would be like going into a book with thousands and thousands of words, finding a word that was misspelled, correcting that word without altering the story. And that's what his theory was, that CRISPR would go in, turn back on the switch that creates fetal hemoglobin without messing anything else up in my DNA. So it would be a precise edit. And he didn't make any promises, but he said in hopes it would decrease my crisis at least by 50%. And I gave him a yes.
Wow. So how revolutionary is everything that you just explained, right? So obviously you're an expert on the disease and the CRISPR at this point, certainly. But when you said it goes in and edits fetal hemoglobin, that's fetal hemoglobin is the dominant, hemoglobin cells present in the fetus. Like when a baby is being, created in the womb, those genetic signatures kind of take over to set the course of our life. And it was as if, genetically you were taken back there and corrected your DNA so you don't or no longer suffer from the effects of the sickle cell disease?
Yes. It would turn on the switch, which is BC11A,
Mm,
to signal my body to start making fetal hemoglobin again. And it would be like living with sickle cell trait instead of sickle cell disease. So I would have half hemoglobin F and half hemoglobin S. And with that, that's why he said 50% decrease, at least 50. But when God shows up, he shows out. It took away completely. Since 2019, I haven't had a sickle cell crisis, a blood transfusion, and by the summer of 2020, I was able to take off my fentanyl patch for forever, get rid of my Dilaudid pills and my hydrocodone, so I am no longer on pain medication.
what can they ask their doctors to seek, better care or to possibly, uh, be treated with a CRISPR technology?
One, you can ask your doctors what options can he provide for you besides pain medicine. That's that's the number one question. And if he can't provide anything more than pain medicine and a blood transfusion, you need to be somewhere else. And another
Because they may
question,
not know. They may not
right?
know.
Another question is if I ask you or if I let you know that a medicine is not working for me, will you listen and change it?
That is a yes. Okay. Sorry. It sounds simple, but there's a lot of folks and Victoria, you could probably tell us like that just don't ask those questions. They just listen to their doctor because that person is the expert in charge with giving them the relief. But sometimes we need to really question, are they partners with us in our care?
Yes. And another question, you can ask your doctor if you don't know how to help me, do you know of any other place I can find advanced treatments? Because some hospitals are just not equipped. They don't have the equipment or the technology to perform these type of therapies and treatments. So just to see if they're willing to recommend you somewhere else.
Absolutely, because many of these health centers, maybe in rural areas or that are not in the big city, they are connected to larger academic centers or have a line in to know what's going on in those places, like you did in Nashville, and refer you to those centers. But many times they may not even share the news with you because of their perceptions. Maybe you can't make it that far. Maybe you're not interested in the clinical trial. Maybe, you know, any number of things. But it's very important to arm ourselves with the questions and go in and ensure that they're thinking as a partner with us to make treatment decisions. How did the trial go, and what was the healing process like?
Okay, so after he described to us what they would do, then it was time for a consent. And we signed that fairly quickly because the other option was go home and enjoy the days you have left with her. But the next thing they did, they sent her to surgery and they put a catheter in her neck to extract her T cells, and that allows the blood to flow out into the machine and then back in through the catheter after they put her blood into a centrifuge and spun out the white T cells. So they did that around March 6th, after we went down there March 1st, and then they gave her the harshest round of chemotherapy that she had received because they had to slow the cancer down so she could survive the 6 weeks that it would take to genetically modify her T cells. And they gave her clofarabine was the name of the medicine, and that completely wiped out her immune system. And then she had to stay in isolation in her hospital room for 6 weeks there at CHOP while they took her cells to the lab and genetically modified them. And then it was a great day for us. You know, whenever Dr. Grupp came in and said April 17th is going to be day one, and we have no idea what's truly going to happen because it's never been tried on a child. So we're going to give her 10% of her own cells back on April 17th, and we'll give her 30% of the cells that we feel she needs on the 18th. And then if everything goes well, she'll get the rest of the dose on the 19th. So it was huge for us because during that 6 weeks, they told us if she even gets a common cold, she can't fight it. It could take her life. So you can't bring germs in the room. And it was very stressful waiting for that to happen. So, but then they did give her 10% of her cells on April 17th. And we allowed, you know, a film crew to come in the room with us because I didn't know any other way to look at it other than, you know, she's going to change the world. So, you know, we want footage of this. So the PR team asked, can we have a film crew follow you that day? And I said yes. And that wasn't easy to do either. But like I said, I'm a positive person. I didn't know any other way to look at it. But day one, she got 10% of the cells and nothing happened, which is good. You know, boring days in the oncology unit are good days. And day two, she got the 30% of the cells, and we actually left the hospital and went to my sister-in-law's in Wilmington, Delaware, until around midnight when she spiked a fever. And at that point, we weren't comfortable being outside the hospital. So we went to the ER and waited till morning. And in the morning, she didn't have a fever, felt fine. And Dr. Grupp came in and said, it's your call, but you know, we feel that this would give her the best chance if she gets the rest of her cells. And we agreed to that. And then we kind of went through the worst part of her treatment. We found out later that every genetically modified CAR T cell can kill 1,000 tumor cells. And when they put those cells back in her body, she weighed around 68 pounds, and 3.5 pounds of her body weight was cancer. So there was so much cancer dying so fast that it overwhelmed her system, and she had what they call cytokine release syndrome, or a cytokine storm, when your immune system just goes crazy. So within 24 hours of getting her last dose, she was hallucinating. She was having severe pain. She was having breathing difficulty, blood pressure difficulty. And they ended up taking her to the intensive care unit and putting her into an induced coma on a ventilator, breathing for her. And she remained that way for 14 days. So very brutal. But you know, we started a blog on day one, and we kept that blog the whole way through. And you know, at that point, it was just asking people to, you know, pray for her if you pray, or send positive thoughts, and that really helped us through that time. But you know, maybe around the third day on the ventilator, the head of the PICU come in the room, and he said, you know, we're the biggest PICU in the country, pediatric intensive care unit. Almost every child we put on a ventilator gets off. Unfortunately, we don't think Emily's going to get off, so you might want to call your family in. And I said, well, I know that she's going to change the world, so please keep trying to help her, because I'll see you at rounds tomorrow. And he pulled me into the hallway and looked at me like I was the most naive parent in the world. And he said, there's a 1 in 1,000 chance your daughter's alive when the sun comes up. You better call your family in. And I said, okay, I'll see you at rounds tomorrow. And the next day, he came with his group of young doctors and said it's medically hard to explain how Emily's still here, but that's why we never give up on a child. And within an hour of that, Dr. Grupp showed up and said the team and the lab stayed up all night identifying what's wrong in Emily's system. And we found this protein that's 1,000 times higher in her system than anybody we've ever seen. It's off the charts. And we happen to have an arthritis drug. We have 2 doses of this arthritis drug that's never been used on a cancer patient that takes that protein down, and we feel like it could give her a chance. And that saved her life. So that medicine was called tocilizumab, and they gave Emily that medicine, and within hours we were hearing the nurses say, we've never seen a child this sick get better any faster. And they were, you know, and I posted online, I believe I'm witnessing a miracle. And she came back to us then and woke up on her 7th birthday from that 14-day coma. And that would be May 2nd of 12. And then 8 days later, which is 23 days from her first dose of CAR T cells, they checked her bone marrow and she was completely cancer-free.
Can you give, 3 practical tips? These can be questions, resources, or just ways to advocate for themselves, to give them the language and the confidence to advocate for themselves and their family.
Well, that's the first thing you got to do is as much research as possible. There's so much more information out there now. I mean, when we were looking into it, it was hard to even find anything about it. There's a ton of information. I tell everybody, do as much research as you can. You have to advocate for yourself. What we learned too is the best doctors in the world are never intimidated by a second opinion. If you have a doctor that gets upset about or threatened by a second opinion, to me that's a red flag where you want to look somewhere else. But also, we are helping create search engines that the average person can use. A lot of people have no idea, or they get on the government website of all the open trials and you can get completely lost. Like I wasn't able to do it myself, where my wife had the knowledge of how to do that. So we're working with several different avenues on making that thing. If you're in the hospital and you type, my child or myself, I have this disease relapse, an easy way to find a contact person, say at Penn or MD Anderson, Seattle, Sloan Kettering, Johns Hopkins, Boston, maybe closer to where you are. You can find a trial that's open where you say, hey, I want to be part of this. If I'm not going to make it anyway, the way I would look at it myself is, if I can be part of trying something that it might not help me today, but it might help somebody tomorrow, I would do it myself. But there's a lot of trials out there right now that are working, and they can't find enough patients to get in them. So again, you can check with us. We do everything in our power to try to find a trial. I have a lot of one of the best things that's happened since Emily got better, and we have all this media coverage is people who probably wouldn't have answered my messages in the past will. So I have access to a lot of people that we just try to ask, hey, here's this disease, here's this relapse patient, this is their situation. Where would you send your child if this is, or where would you go if this was you? And they're really good about getting back to me because they also care deeply about helping the next patient have the same outcome as Emily.
When I take a look back at the person that I was after having these conversations with Victoria Gray and Tom Whitehead, I know today that I've been changed. I've been inspired. There's something that has been birthed in me that is more determined to get this information out through this podcast. I want to reach someone's mom, brother, sister, cousin, uncle, nieces, nephew, papa, and mama. And just as Tom and Katie Whitehead channeled their passion that they had for fighting for their daughter Emily to get into a clinical trial with gene editing, they had the courage and the passion to take a chance. They are now channeling that courage and passion into their foundation, the Emily Whitehead Foundation, which is raising funds to increase patient access to CAR T therapy, precision medicine, gene editing. I also learned directly from people who conquered their cancer, who are channeling that passion for advocacy into professional pursuits. In the case of Dr. Carlo Bufuco, Dr. Bufuco is the chief medical officer of Providence Genomics, and he had a personal experience with a cancer diagnosis while he was in medical school. And that steered him into the field of molecular pathology, of which he is a leading innovator and voice today to ensure patients get access to this critical information. And then with Caroline Yost, our guest for episode 9, she went from patient to advocate for hereditary cancer testing, knowing that she carried a PMS2 gene mutation that increased her risk for breast and ovarian cancer. And then she became a lead marketing executive for the very company, the lab that did her hereditary cancer testing and saved her life. Both of them, through these experiences battling their cancer, became an inflection point for the direction their lives took professionally.
There's also a little bit of a personal history behind this. I usually don't talk about this, but mostly because I feel it's a little bit cheesy, but also because I didn't want it to impact my career, but I think at this point I'm late enough. But I ended up being a cancer patient early on in my 20s. And it was a funny story. There was a diagnostic process based on pathology, which was incorrect, and some biomarkers didn't fit that. I was already in medical school. I was in my 20s, and I catch that. Which I think ultimately had a big impact in outcomes. Was a decision like radiation therapy versus chemo plus surgery, and ended up being the second, luckily. But I think if I had gone down the wrong pathway, probably outcome would not have been as favorable. So I spare a lot of details, but basically, I think that left me with a deep appreciation of how important pathology can be.
What are 3 questions that they could ask their doctors or their providers to help advocate for a comprehensive genomic, profile approach to their cancer care?
One question which comes to me, but maybe because I'm biology driven, would be what is driving my tumor, and if you have that conversation, ultimately you end up into genomic testing. That is the very first one. The other thing that comes to my mind is what are the consequences for my family of this diagnosis? It's often overlooked, and we didn't talk much about germline testing, but it was not really part of this paper. But one of the things that happens when you do this kind of testing, you also find germline alterations, and those have potential impact for relatives, right? Because they could have a cancer predisposing mutation, and I think the conventional number is around 10%. of a cancer patient having those kind of germline alterations, and they can be incredibly impactful for the family members, because we have ways now to screen them early, identify the tumor early as an approach, or even having interventions like surgeries to remove the risk of having a tumor in the future. So those are the first two. The third one, and we talked about that late before, has to do with clinical trials. I do feel that the best therapy for patients is a clinical trial, almost always, and that applies in situations where you have failed therapies, but also potentially in conventional therapies, but also potentially in situations where you have not failed on therapies, but there are other options which are available. And so asking about clinical trials, I think, should be part of the conversation, even at an early stage. So what drives my tumor? What are the consequences for family members? And lastly, clinical trials are three things that come to my mind.
Well, we did the cascade testing. So we went backwards to my mom, since that seemed to be the logical place that this was coming from, and she was the one. The PMS2 did come from her. We tested all of my children. I have 3 children, and they were all negative, so I feel very fortunate for that they don't have to worry about that. And it went beyond my family, though. So that was when I became an advocate for genetic testing in general. Um, I was advocating and proselytizing about genetic testing to anybody who would listen at that point. My friends, anytime I heard about somebody, a friend of a friend who has cancer, I was like, please just ask them if they've had genetic testing. Make sure they do it. I mean, I didn't, it wasn't like on social media or anything, but anywhere, like in my sphere, I was at that point very much promoting getting genetic testing. I mean, in my opinion, this is how strongly I feel about it. I believe that this should be a standard of care. You go to the doctor once in your life, you get genetic testing, they have this done, and you can and not just for cancer. I mean, there's all kinds of conditions that you can test for, because it's all about, so many of these conditions are about prevention or catching things early. And so, yeah, I became a proponent of this long before I started working for the company that did my testing.
We worked together at Invitae, and so I saw your level of excellence firsthand. But you're very passionate about understanding the voice of customer, and now you're the lead to market a product where you have been that customer, the end receiver, the patient who receives that testing. How did that affect your perspective now, sitting in the marketing and sales arm of this product, knowing that you're trying to reach those clinicians, many of which may not know about genetic testing? They may know about BRCA, they don't know about expanded testing, and the importance of your role at the time to expand awareness, to get the test to the people who needed it.
That's a really interesting question, Jerome, because I think when I got there, I was really surprised at the number of clinicians who do not offer genetic testing to their cancer patients. It was mind-blowing to me, to be totally frank. Obviously, the genetic counselors get it. That's their world. But the oncologists, it's not what they were trained in, right? Genetics is so recent. So unless they graduated within the past 5 years, they weren't trained on anything, zero about genetics. And so I had to kind of get into that mindset of, how do we communicate with oncologists without making them not trying to make them feel stupid, because you're just going to make them mad. Don't want to ever do that. But how to communicate them with it, because they do want the best for their patients, and how to present information, how to provide our sales team with information that they can go in and help to educate them in a way that is non-threatening, that is just helpful. And yeah, I mean, the end user is the patient, which I totally understood that perspective, but our audience was actually the oncologists, and really understanding kind of what were the blockers for them. They want to spend time with their patients, but do they have another 10 minutes to explain genetic testing to their patients? Like all of these blockers, and trying to, one of the big goals was just to figure out ways to make this testing accessible for them, easy for their teams. And, and that's part of why, it went beyond just marketing. We really had to collaborate across the board, because it was, the sales team had to be equipped with the tools to do that, and the talking points to do that. And yeah, so it was interesting. And just kind of on that note, and I think I mentioned this to you recently, I I don't remember if I did or not, but just recently a friend of mine was diagnosed with breast cancer, and I said, "Please be sure that you get genetic testing." And she asked for genetic testing in her next appointment, and the doctor said, "Oh, you don't need that."
Mm.
I literally almost blew a gasket. I was so mad. I was so upset that this is a doctor who has my friend's life in their hands, and they're
Yeah.
telling them that they don't need genetic testing. So I literally got online and I went and I copied the guideline and the link, and I sent it to her, and I said, "You bring this into your next doctor's appointment and tell them to please do genetic testing. Don't ask if they think they you need it. Tell them you need it." And that's something that I feel like is a balancing act, as way beyond when I worked at Invitae, but just when I am trying to kind of coach my friends or my family and advocating for themselves. If a doctor doesn't think you need something, but you do, how to have that conversation and request it firmly and get what you need, even if they don't think you need it. And if they won't do it, there's patient pay prices out there. There's other doctors who find a way to do it.